In the 1940s, kids with heart problems were beginning to be diagnosed, and in some places on the East Coast were operated on. And a doctor from the East Coast named Paul Lurie, he came here as the first pediatric cardiologist in Indiana and the first director of pediatric cardiology at Riley Hospital. In 1951, he was the first in the country to perform percutaneous cardiac catheterization in kids. He was a pioneer in pediatric cardiac catheterization, and his successor, Dr. Girard, perfected that technique. When I came here in 1973, I had went to the cardiac cath lab and I saw Don Girard do a percutaneous cardiac catheterization. I couldn't believe it.
You know, we've been at pediatric heart surgery here since really the late 1940s. We were one of the first programs in the countries to take on pediatric cardiac surgery. It started with Dr. Shoemaker, who came here in 1948, continued on with Dr. Harold King, and then I was the third chairman and chief of cardiac surgery, and then Mark Turrentine, one of my trainees, is now the current chief of cardiac surgery. So there's only been 4 of us in about 80 years.
John is also noted for coming up with a number of very innovative firsts in open heart surgery. The youngest kid to have a heart transplant, John did that, and with help from Mark Turrentine, did the only newborn twin-to-twin heart transplant in the world.
I started the cardiac surgical transplant program here at IU in 1986. With many babies, the heart transplant requires the transplantation of the heart, but frequently the major part of the aorta, the main artery that comes off the top of the heart that goes to the head vessels and that sort of thing. Those are the big challenging operations that we do. That and the arterial switch operation, where we take the baby's tiny coronary arteries out of the vessel that they arose in and transfer them back to the vessel they need to be into. And we're talking about vessels that are 2 millimeters in diameter. And those are very challenging operations. And I have to say our outcomes seem to be always in the top 10% of the country, just because we have a lot of experience and a lot of know-how with a lot of people and a very good, well-organized, experienced team to carry out the care of these children. So it's been a great place for me.
Mark Turrentine, professor of surgery, Indiana University, and I've been at Riley as a faculty member going on 34 years. When I came here in '88, I was a resident. We had heart patients in about 6 or 7, maybe 8 different locations in the hospital. It was an age-based philosophy at the time. So if you operated on an infant, they're on the infant unit. If you operated on a school-age kid, they're on a school-age unit. Teen unit, NICU, there was no coordination of care. And that really changed, in the second decade of the 2000s.
My name is Jeff Sparing. I was the president at Riley from 2011 to 2015. Historically, where we had always thought about things as either age-based or we would kind of group patients together, it really gave us the chance to think about, could we kind of create a whole new model and a paradigm for that care? With the Simon Family Tower, could we put cardiac care, cardiac intensive care together in geographic space to think about the multidisciplinary team together in a completely different way? And I think it was a great example of where we're now seeing most children's hospitals go as when they think about programming in new buildings. It really is about that expertise of specialty being together in one center to be able to do that work where kids are getting the best outcomes.
I think what clearly is the case today and implemented more and more is this fully integrated care model. And I think that eliminates variability. When you reduce variability, you enhance outcomes. So our observed over expected mortality has always been less than 1. So we're proud of that. When I first came here, not everybody was offered surgery. A lot of parents were told, we can't do anything, take your baby home, love them as much as you can. And, today, it is rare that we ever tell a family we can't offer something. It's really rare. There are more patients with congenital heart disease in this country now that are adults than there are kids, because they've survived through the early part of their life being repaired. Now they have congenital heart disease that's been repaired, but they have other problems now that need to be addressed. That population has to find a home. So what we've done here is that if that individual has the need for a congenital heart surgeon, then we'll do them here. There aren't very many places in the country that have this. And that continuum of care carries up even into age 35 or 40.
My name is Leighton Akins. I've come to know Riley through my 2 heart transplants here. Started in 2005, age 5. I was diagnosed with restrictive cardiomyopathy, and that's how I got my first transplant. Once I got to about 18, 19 years old, I started to notice quite a bit of symptoms. And then once I hit 20, 21, that's when I really noticed, this is becoming a big problem. This is when I need some treatment. This is when I need help. They discovered some irregularities in my heart. What they found there was the restricting of the coronary arteries, just the beginning stages of it, but they went ahead and made the right call to put me on the list for another transplant. So I went on a waiting list for about 5 years until I became too sick to not be in the hospital with medical assistance to help my heart. Then in 2021 of August, I got my second transplant. The people in the ICU treated me fantastic. They were anything I needed, they got right away. They knew my history, they knew my body way better than anybody else with all the lab reports and all that. I'm 24 now, so they're still taking care of me to this day. It's a whole different story today. I feel amazing. Just yesterday I played full court basketball for an hour and a half, didn't sub out, and able to play golf, pickleball, all my favorite sports. I feel fantastic. Mentally, I'm just better than ever, just because I feel so secure in this heart and my health. And it's enabled me to live my best life.
This place, Indiana University and Indiana University Health, is so understated in what has gone on and what has developed here. A lot of phenomenal innovation has occurred, not just at Riley, but also Methodist, IU. All that makes up the IU health system, rich history of innovation and capability.
And it's the cooperative thing that goes between cardiologists, the nursing staff, in and out of the operating room, and then the cardiac surgical group itself. It has been a great place and will continue to be a great place. And just because it's the right culture, it's the right attitude, and we have the entire infrastructure that it takes to pull it off.